Well, thank you, Mr. President. I don't get chances to say that too often. So thank you for your warm welcome and for your leadership here at the hospital. Sister, thank you again for all of the work that you and the sisters do. I'm very proud to be back to St. Joseph's, where I have been here on various occasions. This is one of the most incredible health institutions in our state, and providing high-quality health care to residents, not just in the Paterson, but in the greater Paterson area, and where you've pioneered alternatives to opioids, something we are focused on dramatically in Washington, as we see too many of our family members both get addicted and then ultimately die as a result of the addiction. And what you have done here as the ALTO program is something that I and Senator Booker were happy to make a national model and include in federal legislation that became law, so that all providers can follow your example in terms of the fight against addiction. I was also here when we were trying to renew the Children's Health Insurance Program, which is so critically important to the health care of our children. And I'm thrilled that we got a 10-year renewal of the Children's Health Insurance Program. And as we speak, in the budget that is being finalized, we're tacking on another 2 years to the Children's Health Insurance Program. So those are all good things that come from when you go to St. Joseph's Hospital. So I want to thank you for welcoming us again, and to your dedicated staff. I want to thank Commissioner Caride for all the hard work she does for all of us as New Jerseyans in the Department of Banking and Insurance. She's been a stalwart advocate, particularly on the question of creating greater health care coverage for our families. It's that time of year again, time for individuals and families to take stock of the past year and prepare for the new year to come. I'm not talking about the holidays and making New Year's resolutions. Those are all great too. I'm talking about health care and making sure that everyone gets covered. The Affordable Care Act enrollment period is underway, but the deadline is just days away and fast approaching. If you do not have health insurance, it's time to get it. If you have insurance but your health care needs have changed, now's the time to select a new plan that works for you. If you have family or friends or neighbors you know who do not have health insurance, you need to remind them to get covered. And you have until December 15th to enroll. That's just a week from this coming Sunday. A week only from this coming Sunday. So don't let the opportunity pass you by. Once it passes, you're shut out for another whole year. Getting covered is not just about protecting the health and well-being of you and your loved ones, but ensuring you're not one illness or one injury away from financial ruin. And I have experienced this with individuals who have come to our office and faced that challenge. They are one illness away from bankruptcy. One of the things that we did when we were writing the Affordable Care Act is to ensure, for example, that there were no more lifetime limits. Before the law, most insurance policies had a lifetime limit, a ceiling. When you hit that ceiling and you were over it, you were on your own, one illness away from bankruptcy. If you had a major illness of any type and you had exceeded your ceiling, your cap, you were on your own. We eliminated that for all insurance as a result of the law. We eliminated that if you were a child born at birth with a birth defect and therefore had a lifetime of pre-existing conditions discrimination, or if you had a husband who had a heart attack on the job, or a woman with cervical cancer, you had a lifetime of pre-existing conditions, discrimination, and limitations. We eliminated all of that under the Affordable Care Act. So not only did we make it more possible for people to get health care, including those who had some illness or some pre-existing condition in their life, but we made it more possible to ensure that you're not one illness away from bankruptcy as a result of having a lifetime limitation. That and so much more was in the Affordable Care Act. So taking advantage of that is something that I've been an advocate during each enrollment period, and it's really easy. All you have to do is go to getcovered.nj.gov and you can get help. And if you need help, you can come here to St. Joe's or one of 43 other designated organizations across the state where sisters are standing by to guide you through the process. And the state even has a toll-free hotline, 1-800-446-7467, 1-800-446-7467. There's really no excuse not to get covered. It's the smart and prudent thing to do for yourself and for your families. As someone who helped author and pass the Affordable Care Act into law, I want to thank Governor Murphy and his administration for being allies in the fight to protect New Jerseyans from relentless Republican attacks on the law. For 3 years now, I've fought tooth and nail against efforts to repeal the Affordable Care Act because I wasn't about to let the president take away all the things that we fought so hard for and won. But President Trump and those in Congress are trying to kill the Affordable Care Act through a death by 1,000 cuts. As we speak, the president's Attorney General is arguing in a federal court that the law is unconstitutional, that protections against pre-existing conditions are unconstitutional, that lifetime caps are unconstitutional, that being able to keep your child on your insurance until the age of 25 is unconstitutional, that the special women's provisions that we have in the law for women's health are unconstitutional. If they succeed, and there is, I can tell you as one of the members, the senior members on the Senate Finance Committee that deals with health care in the United States Senate, there is no plan and no discussion and no alternative to be offered if they succeed in court. If the law is declared unconstitutional, then all of it gets swept away. All of it gets swept away. And so it's an incredible, risky moment for so many who have achieved health care and the protections the law provides as this battle takes place in court. But while they're in court trying to declare it unconstitutional, they've eliminated the individual mandate, which is essential to the Affordable Care Act's fiscal stability. We're proud to see that the state of New Jersey stepped in and required one for New Jerseyans. They made it impossible for insurance companies to, they made it possible, I actually should say, they made it possible for insurance companies to offer what we call junk plans with coverage that is far from comprehensive and fails to include the core essential benefits under the Affordable Care Act, like maternal or mental health benefits. Once again, the state has stepped in to protect New Jersey patients from finding out the hard way that when they need their coverage, it's really not there. And President Trump has made it harder and harder to even enroll by cutting the enrollment period from 3 months to just 6 weeks. From 3 months that we had to get people to understand the opportunity to look at the tax benefits for those who need it, for those to look at whether they qualified under Medicaid expansion, and so many other provisions of the law to get health care. We used to have 3 months to do this. Now we only have 6 weeks to do it. And slashing funding 90% for the navigators who helped ultimately help people navigate through the system so they could understand the possibilities of getting health insurance. And for the advertising, reminding individuals about the possibility during this open enrollment period. These efforts to sabotage have taken its toll. Since President Trump took office, 40,000 fewer New Jerseyans have health coverage, a drop of nearly 14%. Current enrollment in New Jersey at this point, with the deadline looming, is down over 26% since President Obama handed over the reins. That's why it's so critical to get the word out, to tell your friends, family, and neighbors to get covered. So we have an opportunity to take our own destiny into our own hands and to ultimately get covered. I'm proud that thanks to the Affordable Care Act's expansion of Medicaid and the creation of tax credits to help people buy coverage, nearly 1 million more New Jerseyans have health care coverage today who didn't before the law. No one here wants to go back to a time and place where seniors hit the donut hole in their prescription drugs and couldn't afford their prescriptions. We eliminated that lapse in coverage for senior prescription drugs. We don't need seniors to have to choose between paying their rent or keeping their home, putting food on the table, and having access to life-affording drugs.
Attention, please. Mass will be celebrated at 12 noon in our hospital chapel. All are welcome. Mass will also be televised on Channel 6.
When high blood pressure meant you could be denied for health insurance coverage, and when expectant mothers find out their insurance did not include maternity care, or when a newborn hit a lifetime limit for coverage before she even left the hospital. All of those things, all of those concerns were negated under the Affordable Care Act. Access to quality, affordable care is something that we all need. Even the healthiest person gets sick. Even the most agile and fit athlete falls and gets hurt. Our health is so critically important to our ability to work and live full lives. We're all sometimes one diagnosis or accident away from a complete shift in our life's trajectory. That's why all I can say is get covered. Do it now. Don't wait. Before you know it, it may actually be too late. And I'm appreciative of our Commissioner, the Department of Insurance and Banking, who's been such a stalwart in this effort since New Jersey passed the laws, and it's her department that enforces it, to be with us today. Commissioner Marlene Caride.